Now I want to bring in Dr. Janette Nesheiwat, who joins me. She is a board-certified medical doctor of family and emergency medicine. So, Dr. Janette, as somebody who works in a hospital, what additional precautions are you and members of the hospital staff taking?
Sure. So, Lana, first and foremost, it's so important that we protect ourselves so that we not only protect ourselves, but we don't spread viruses to other people, to the patients. So, from head to toe, we wear a mask, goggles, gowns, gloves, and we do that with every patient that comes in, just to make sure that we are minimizing the potential spread of virus. So that's most important, in addition to the basics of everyone keeping their hands washed and clean regularly, and not just after you leave the restroom. And the studies show that 30% of people do not wash their hands. So we can significantly reduce the risk of transmission of infection, viral infections, bacterial infections, simply by washing your hands.
Are you seeing behavioral changes that you think will last beyond the coronavirus?
That's a great question. I hope so. We're seeing, disinfectants, Purell, hand sanitizers, more soap stations, hand washing stations, people washing and disinfecting countertops, cell phones, remote controls. I certainly hope so, because not only will it help protect against spread of virus, but other diseases, especially those where we get what we call superbugs, where we don't have the antibiotics to treat certain infections or antifungals and that sort of thing.
You mentioned our cell phones, and actually I believe that the CDC recommends that you clean your cell phone once a day. Is that necessary, or maybe it's once a week? How often do you actually clean your own phone?
As much as I possibly can, because especially being in the hospitals are mediums for, bacteria and germs. So anytime I have the opportunity, I will wipe it down with a disinfectant. Of course, I'll use gloves while I wipe it down, and then I'll wash my hands afterwards. Especially if you put your phone face down and then you hold it up to your face, you're transmitting germs back and forth. And that's one of the other things we say not to do. Don't touch your face, your eyes, and your nose. So you're bringing up a contaminated object to your faces, which can make you more prone to picking up virus or bacterial infections.
Now, President Trump has been accused of downplaying the coronavirus. He's correctly said, though, that thousands of people die from the flu each year. But what makes the coronavirus so much more concerning to medical professionals?
Well, first of all, it's new, Lana. It's this novel virus, a new disease. It's spreading in a naive population, meaning we don't have immunity to it, and anyone is susceptible to it. So that's the concern. It's creating a level of anxiety and panic, but we shouldn't panic. We shouldn't, be fearful. What we should do is take precautions, be vigilant, and stay up to date with the latest information so that you can protect yourself. For example, no not to travel, to go on a cruise ship. No not to travel to an area where there's a known outbreak. For example, Italy, huge outbreak with many deaths. So knowing this information can help you, arm you with the tools to keep yourself healthy, to keep your neighbor healthy, and your family healthy.
Well, we heard Dr. Fauci say that if you are healthy, a lot of those types of activities are otherwise fine. But if you are in one of those at-risk groups, if you have an underlying medical condition, or you're in the senior citizen population, that you should be concerned.
Absolutely.
At the White House press conference, we heard Vice President Pence say that he didn't know if President Trump had, in fact, been tested for the coronavirus. And the backstory for our viewers is that two members of Congress who spent time in the president's car and shaking the president's hand, in addition to being on Air Force One, they're now in self-quarantine after being in contact with a person who has, in fact, tested positive for the coronavirus. So I'm wondering, in your medical opinion, does the president fit the profile of a person who should be tested for the virus?
That's an excellent question. The risk of transmission from that one person that tested positive, I believe it was just a handshake, and then that person, was exposed to another person, and then the president came into contact with that person. The risk of transmission is extremely low. It's possible. Nothing is impossible, but the risk of transmission is extremely low. Right now, he would not meet the criteria for testing. You have to meet criteria, chest pain, shortness of breath, fever, body aches, malaise, those sorts of things. Now, the fact that he's the president, makes it a little bit more special. He probably will, out of abundance of precaution, privately, quietly get tested, and then maybe release that information to us. But the risk of transmission is extremely low and probably unlikely, even though anything is possible.
So let's talk about that risk of transmission. Remind our viewers, how long can somebody be infected with coronavirus before showing symptoms and be contagious to other people?
Sure. So you can potentially pass it to another person, be asymptomatic, without having symptoms. Asymptomatic meaning I can spread it to you and not have any symptoms. You can be a carrier, and the incubation period can last up to 14 days. That's just an estimate, approximate. We don't know the exact number. We don't know the exact days, but 14 days is a good amount of time. Usually for most viruses, a few days, you'll start to see symptoms. You'll start to feel symptoms. Most of the people that do have symptoms, though, Lana, are extremely mild, and the majority of people that contract the coronavirus will not require any medical intervention.
Dr. Janette Nesheiwat, thank you so much for
pleasure.
joining us.
Thank you, Lana.